Good morning, everyone. Good afternoon, good evening, wherever you are in the world right now. Thank you so much, so much. Nag-twist yung tongue ni Nurse Rebecca. Thank you so much for watching today's episode of Pinoy Nurse Portal. This is not a reel, however, it's still real, R-E-A-L. We are filming a lengthy video. Ano bang magandang angle? Ganyan? Ganyan? Well, anywho? Okay. Whatever. Okay, so let's talk about the flow ng shift. Okay, whether you work day shift, night shift, kung meron mang evening shift, usually in the United States, our shift are either 10 hours. So if you work 10 hours, you will work 4 days a week. If you work 12 hours, you work 3 days a week. In my case, I work 12 hours, I work 3 days a week, okay? So, can you choose your days? Yes, we can choose our days, and usually sa amin sa hospital we use chronos to write our schedules, and we are divided into two groups. Meron kaming group A and group B. So let's say for example on the next pay period, group A will go first. They will choose their days, and bawat isang araw ang limit sa unit namin is up to 6 nurses, okay? Let's say for example, doon sa isang araw na yon, 6 na ang nag-schedule. When it's your turn to write your schedule or choose your schedule, hindi mo na maisisingit yung schedule mo doon. And I'm talking about our system in our unit or in our hospital, we use chronos. I don't know what it will be, but just to give you an idea, merong ganon sa United States. And yes, you can definitely choose your days. And how many request days can you have? Now, again, every hospital will be different, but in our hospital, we can request up to 4 days na R, okay? Bukod pa doon sa regular day off mo. Let's say you are to attend, let's say a concert ng BTS or ng The Rose, o kaya meron kang a-attend ng wedding, you could put R on those days, and you could choose up to a maximum of 4 days. Depende sa hospital ninyo. But in my previous hospital and my current hospital, they will allow us to choose up to 4 days. Let's say the 4 days of request off is not enough. You can use your paid time off, your vacation time. So ilalagay mo RRR ng, let's say December 1, 2, 3, 4 are your requested days. You could use your PTO doon sa iba mong days na gustong gamitin. Okay? Kung gusto mo ng lengthier days off or vacation time. Okay? But parang ang laki ng boobs ni Nurse Rebecca. Nahiya tuloy ako. Well, anywho, so let's start na flow. Let's say you work, pag-usapan natin yung 12 hours because yan yung schedule namin. So pagdating ninyo, of course, you will clock in. Paano yung pag-clock in? It's not that you don't know how to clock in, ha. Sa facility namin, you can clock in 7 minutes top of the hour. Our shift is 7 p.m. to 7:30. Why is it 7 to 7:30? Because yung 30 minutes break mo is not paid. That's why I always encourage everyone to use their break wisely, okay? You have to really use that because that's not paid. Huwag tayong magpakahiro. Not unless yung naghihingalo talaga yung patient niyo. There will be a shift in your lifetime working in the United States na wala kayong break. And since we are paid every hour, pwede nyong isulat yan na on that shift, you did not have a break. So, meron yan you just have to send an email to your charge nurse, i-CC mo yung manager, and they will approve that, okay? Depende yan sa policy ng hospital niyo, but you can do that. Your 30 minutes break na hindi mo ginamit will be paid, okay? Excuse me. But it really has to be reasonable, okay? So, yun na. So, magka-clock in ka. You can clock in 7 minutes top of the hour or 7 minutes, wait. You can clock in 7 minutes before top of the hour or 7 minutes after top of the hour. Ibig sabihin, 7:07, pwede ka pang mag-clock in. That's still not late. At least in our facility, late ka kapag 7:08 ka nag-clock in, and early clock in kapag 7:22 ka nag-clock in. 7 minutes before and 7 minutes after, yun yung window na hindi ka early clock in at hindi ka late. Okay? So, nag-clock in ka na. What do we do in our unit? Pagkatapos mong mag-clock in, because we have to wear the hospital supplied scrubs, we have to change. After that, the charge nurse of that shift will give a huddle. What is a huddle? It's a mini mini meeting. Okay, they will discuss the goals of nung unit ninyo that night. They will share some issues na nangyari the previous shift, the things you need to watch out. Let's say you have a DNR patient, let's say you have an AMA hold patient, you have a patient on restraints, ano pa ba, if you have a patient na medyo pasaway that we have to watch out, or any relatives na pasaway, something like that, something to remind everyone. Okay, and ano pa ba? So after the huddle, we don't ask questions because we want the huddle to be quick. It usually will last, the most na is 10 minutes. If the huddle lasted more than 10 minutes, it means something big happened, okay? Or there is something major going on in your unit. Okay, so after the mini meeting or the huddle, you will go out of the nursing station, kasi yung huddle namin ginagawa namin sa break room, or some hospitals will have a conference room, they do it there. Alright, so depende yan sa hospital ninyo, but you will definitely have a huddle. And then after the huddle, you will go check, you will get report from your nurses. Let's say you have 4 patients, so you have to receive report. In our unit, we have to do a bedside report, meaning to say we have to be at patient's bedside. Ang hospital namin is semi-private yung rooms. Very few lang yung rooms na private. So it will depend on the hospital na pupuntahan ninyo. So kapag nagre-report ka, is it okay to talk about that patient na meron siyang roommate? Because we are in a hospital setting, yes, it's okay. We do talk about the patient. But for example, may limitations or restriction yung patient, we talk about or we give report outside the room. And after we do that, we go to the patient's bedside. Ang gagawin ng outgoing nurse, the outgoing nurse will introduce the incoming nurse. Okay, let's say I'm the outgoing nurse and I will introduce Miss Tapia. I will tell my patient, "Hello, Mr. Lee. I'm about to go home now. Miss Tapia will take good care of you." And in that introduction, kailangan mong ibenta si Miss Tapia doon sa patient mo. She's a really good nurse. She will take good care of you. Okay? So do you have any questions? Ganyan. If you want to say that. Or I could just say, Miss Tapia will take good care of you. Okay? And then now, let's say ako si Miss Tapia, what I will do is, "Hello, Mr. Lee, I will be your nurse today." Yung ganun lang. Okay, just briefly. And we are currently doing our rounds, or we are doing handoff right now. I will be back to see you. Okay, do you have, is there anything I could help you with right now? Okay. Yun yung sasabihin mo when you receive report, and you will do that to all your patients. Now, depending kung gaano ka busy yung patient ninyo, everybody has their own preference. Let's say all your patients are stable, which patient you want to see first? I will personally see the patient who is asking for pain medicine because like I said, if you've been following me, and for those of you who are new in this channel, I work at a burn unit. So, totoong may pain ang mga pasyente namin. So, whoever is asking for the pain medicine, that will be the first person I will check. Okay? But, let's say for example, sa report, merong tawag dito? They told me that the patient is bleeding. Well, I did my rounds anyway. So kapag yung handoff, that's why it's very important to do a bedside rounding. Because if the outgoing nurse will tell you that one of your patients is bleeding, you could check right there and then the bleeding area. Okay? Make sure that you mark the bleeding area. See it if will progress. Okay? So usually mga naka-ACE-RAP yung may bleeding area, or kung walang ACE-RAP, you have to draw doon sa bleeding spot. Let's say for example, ang ginagawa ko dyan, ihahawakan kong ganyan with the gloves of course. Kapag basa yung it means active talaga bleeding. Okay? Gaano ba yan? Pwede pa ba akong maghintay para ma-rounds ko yung iba kong patient? Depende yan. Kapag nakita mo pag-angat ng paa puro blood, that cannot wait. That will be your priority patient. Okay? But let's say you don't have anyone na may chest pain, everyone is stable. So the first person I want to see is the person who has pain because I want to address that pain. Okay? But it will depend on your unit. Kasi nga, burn ako. If you work in a med-surg telemetry unit, iba ang acuity dyan. Mas mabigat ang acuity ng telemetry unit. Okay? You have to learn to really manage your time. Alright, so let's say for example, nabigyan ko na ng pain medicine yung aking pain seeker patient, I'm sorry to use that word, nung aking may pain na patient, okay, so he is okay now, and then yung bleeding ko, hindi naman nag-progress, nilagyan ko lang ng line, yung area na na may bleeding, and in my tawag dito assessment, hindi ko kailangan pang tawagan yung doctor doon sa bleeding. What will I do next? Okay, now if you have time, I will open my patient's chart, lahat ng patient ko isa-isa. If it's my first day, it is my practice to check the patient's H&P because I want to know their background. I will check the active orders. I will check the latest labs of the patient, okay? And then I will look at my work list. Titingnan ko ngayon sa work list ko. After that, I look at my work list. If your charting software is Epic, meron silang work list. I forgot about Cerner, although I've used Cerner back in 2012 yata. Nakalimutan ko na. I'm sure may work list yan. So look at the work list. Because my shift starts at 7 p.m., kung sino yung patient ko na merong medication due at 8 o'clock, okay? Let's say hindi ko pa tapos basahin lahat yung chart ng patient ko and I have a work list, a medication due at 8 o'clock, uunahin ko yon. And then I will go back to reading the H&P and reading the chart of my patient, okay? Because usually for night shift and in our facility, we start passing meds at 2100 and we use American time not American time. Oh my God. Military time. We use military time. So 2100, which is 9 o'clock. How do you calculate the military time? Plus 12 mo lang. Okay? So 9 plus 12, that's 2100. So 2100 usually yung schedule ng medication, not unless they have a Q8 IV pain medicine, iba ang timing yan, or meron silang Q6 na medication or Q3, okay? But yung standard na BID, TID medications, 2100 yung una mong medication. So if the medication is not time sensitive, you can give the 2100 medication an hour before or an hour later. So don't be rushed. Don't feel that you have to really give that medication at 2100. Not unless it's like, ano ba yung mga medication na time sensitive? If the medication is time sensitive, you really have to give them on time, okay? Or within the window period na pwede mong ibigay yung medication na yan. So, after that, kapag nakita mo na yung checklist and when you go to the patient, let's say you have 4 patients, you have A, B, C, D patient, and you decided that you want to go see patient A first. Okay? Meaning to say, when I see my patient, I will not only assess, I make sure that I will do everything na, ano bang tawag dyan? Compound. Compound your task when you go to the patient's room. I take my medications, I bring my water. I don't know if the patient will have water or not. So I will bring my water, and then depende kasi yung ibang CNA magbibring sila ng water. Pero sa amin kasi, because we have usually mababang acuity. So I will bring my water, I will bring my medication. You will bring saline flash. I will put it in my pocket. Alcohol, little pads of alcohol. I will bring my Kyros cups. I will bring the hot dog and the burger Kyros cups. Other nurses call it husband and wife. Ano ba yung Kyros cups? It's this one. This is the hot dog. Okay? Or the husband, and this is the burger or the wife Kyros cup. Okay? So yun ang dadalhin ko sa patient's room. So alcohol, alcohol pad, saline flash, Kyros caps, ano pang dadalhin mo? Kailangan meron ka ding scissors and you have to bring your stethoscope. Now, it depends on the area na pupuntahan mo. You have to have your own stethoscope. Sa hospital namin, we have disposable stethoscope and we use that. Every patient will have a disposable stethoscope. Depende yan sa hospital na pupuntahan ninyo. So now, since I want to compound my task in that patient's room, I will do my assessment. I will do my daily care kapag konti lang yung daily care ko. Kaya usually, kapag stable silang lahat, the patient that is total care, that will be the last person I wanna see. Kasi mag-change ka ng diaper, magfo-Foley care ka, magbibigay ka ng medication doon sa dual tube niya. And in our unit, hindi na namin ginagamit yung, when the patient has a dual tube, we don't use the stethoscope and listen yung the gargling sound. No, we use the core track. Ano yung core track? It's this one over here. Okay, so you have to connect the stylet. Ito yung stylet, i-connect mo siya dito sa core track na to, and then ipupush mo ulit yung stylet doon sa dual tube ng patient. It will tell you the placement nung yung dual tube, and it's really effective and efficient. Okay, let's say for example, kasi sa burn, we give their nutrition not parentally. Oh my god, I cannot speak. Parenterally. Okay, so hindi IV yung nutrition nila. We give it in their gut, okay, through the dual tube. And if the dual tube is post pyloric, meaning to say it's in the duodenum, if the patient is going to surgery, we don't usually stop their tube feed because it's in the duodenum, okay? And it's okay, but that's also okay with anesthesiologists. In the beginning, ayaw ng anesthesiologist, what? You did not stop the tube feed of the patient at midnight? But if the dual tube, and this is in our hospital if the dual tube is post pyloric, meaning to say nasa duodenum siya, we don't stop the tube feed. Now again, don't take my word for it. Check the policy and protocol of your hospital or your unit, okay? So yun. So pag naka-dual tube siya, ano pang meron sa patient? Let's say meron pa siyang colostomy, patient has wounds in the butt, kailangan mong linisin, naka-diaper. Usually we don't use diaper or in the hospital. Gusto nila, open lang yan, okay? Kung kailangan ng turning, as long as this patient is stable, this will be the last patient na i-visit ko amongst my 4 patients, okay? So prioritization, wag mong pupuntahan yon, not unless this patient is not stable, yung madaming nakakabit sa kanya. So I will go to the walkie-talkie first. It will be easier to pass your medications. You don't even have to dick their medication. You just have to tell them that you are going to give them their medication. Okay, so that's how I do my night. That's how my night flows. Sa regular na night, not unless there's an emergency. Okay, and ano pa ba? So tapos na akong mag-assessment, tapos na akong mag-daily care. Now it's time to chart. I make sure that I will chart before midnight. You know why? Ayokong nagka-click na baguhin yung time, yung date. Kasi sa Epic, you will just add column or add, nakalimutan ko yung isa So ayokong magdi-default yan doon sa time range na magcha-chart ka. Usually mga alas 9, wag naman. Sige, alas 10 na lang. Alas 10 tapos na akong mag-chart. I really make sure na tapos na akong mag-chart before midnight. But on busy days, because nursing is unpredictable, may times na nagcha-chart ako after midnight, but I make sure na no matter how busy I am, kailangan 4 o'clock in the morning, sarado na lahat ng chart ko. That way, if anything will happen after 4 a.m., meron akong time na gawin yung emergency na mangyayari. Sometimes at 6 o'clock may mangyayari sa patient mo, pauwi ka na ng 7 o'clock and you did not close your chart at 4 a.m. Ano bang ibig sabihin mag-close ng chart? It's the same thing in the Philippines. Kailangan yung charting mo, yung assessment mo, we chart kasi ng 8-12-4, okay? So if you're using Epic, meron yung choice na focus assessment. I-click mo lang yung focus assessment, not unless there are changes, you have to click doon sa area ng change. Let's say for example, nung umpisa your patient was okay. Let's say at 4 o'clock the patient started vomiting, yung GI na lang ang i-chart ko. I will click focus assessment and I will go to the GI part na naging nauseous yung patient or the patient vomited. Okay? So yun yung charting namin. So 8, the whole assessment head to toe. Midnight and 4 a.m. we just do focus assessment. Next, I will check the I's and O's. Make sure that the I's and O's, meron kaming kailangan address yung I's and O's every 4 hours. Whether the patient poop, whether the patient peed, or the patient drink or eat anything, nilalagyan namin yung column ng 8, 12, and 4, and that's our unit. If the patient did not eat, poop, or pee, doon sa 8, 12, 4 na yon, we put 0. That way, they know that we address their intake and output. Okay? Let's say your patient peed, poop and ate at 8 did not pee, poo, and ate at 8 o'clock, but they ate at 9 o'clock, doon mo i-column yun. But you still have to address the 8, 12, and 4 eyes and nose, okay? That's the eyes and nose. Pain is very important. Whether they have pain or not, in our unit, we have to address their pain every 4 hours. So you have to have a charting ng pain ng 8, 12, and 4, okay? Next, make sure that all your medications, eyes and nose, are credited. Because unlike Cerner, in Epic, when you chart your eyes and nose, kapag in-stop mo siya sa inyong MAR, medication record, it will not automatically populate on your eyes and nose. So you have to manually click the calculator doon sa Epic and it will populate your output. Okay? So we have the assessment, pain, eyes and O's, ano pa? Lahat ng charting in our hospital, yung dressing. Did I do my dressing? And then we also do our plan of care. You have to address your plan of care and your education. And I forgot, at the beginning of the shift, the moment you read your chart, we have to acknowledge that we did it by charting chart check. We're doing chart check, okay? Minsan nakakalimutan ko yan kapag busy, but it's okay. What's important is at 4 o'clock, sarado na yung chart mo, okay? Now, after that, ano pa bang nakalimutan ko? Yung lab draws, minsan nagda-lab draw kami, but for, let's say for example, we get medical patients, ang labs ang nagko-collect ng blood nila. Alright? So I think that's it. That's what I do and that's what we do. Yan ang flow ng isang shift ni Nurse Rebecca. After that, relax ka na lang. Kapag na-close mo yung 4 o'clock mong chart, and then relax ka na lang. All you have to do is to give your medications na do ng 5 a.m. or 6 p.m. 6 a.m. Okay? If you work night shift. Usually, may mga medications yan ng 7:15 and usually yung medications na 7:15 may nakalagay yan na with meals. So, if it's with meals, ang meals kasi sa floor namin ay hindi pa yan ma-deliver ng 7:15. So, that will be the morning shift task. Okay? But then, check the policy and protocol of your unit kung yung 7:15 medications ba has to be given by the night shift or the day shift. Alright? And what about AccuChecks? If your patients have AccuChecks ng ACHS, sino ang kukuha nung AC na pang umaga? Usually scheduled yan ng 6:30 in the morning. In some areas, they do their AccuChecks, okay, kasi mas maagang dumadating yung train nila. But in our floor, again, check the policy and protocol of your unit. In our floor, we don't do our AccuChecks, the 6:30 a.m. one. The day shift will do that, okay? At least this will give you a little flow or a little idea on what you need to do during your shift. Okay, a little note. If your patient has a telepack, part of your assessment should check that your telepack is placed properly. A telepack looks like this and it will have leads. Okay, ito yung itsura ng leads sa check ng patient. Your telepack can have 4 leads or 5 leads, depende kung anong hospital ka pupunta. You have to know where to place them, and it has to be part of your assessment sa initial assessment ninyo. All right, there you have it, guys. I hope you learned something in today's episode of Pinoy Nurse Portal. As usual, thank you so much for watching today's episode and thank you so much for following Nurse Rebecca. See you on our next post and please comment down below kung anong gusto nyong matutunan. Kahit ano, don't be shy, okay? Learn to be assertive by asking questions now kay Nurse Rebecca. All right, see you on our next post.